Eid Mubarak, good evening, and thanks for staying with Lagos Television. You're watching Sound Health. I am Olasumbo Modupe. The Delta variant has now spread to over 104 countries, including Nigeria. What's next? Is there a potential third wave, and how do we overcome this virulent strain? We will find out from my resource person after COVID-19 updates.
WHO Emergency Committee has raised concerns that the COVID-19 pandemic is being mischaracterized as ending while it is nowhere near finished. The committee also warned about the strong likelihood for the emergence and global spread of new and possibly more dangerous COVID-19 variants that may be even more challenging to control. They called on all countries to support WHO's goal to vaccinate at least 10% of the population of every country by the end of September. Following the emergence of the Delta variant in the country and the rising number of new cases and hospitalizations, the Presidential Steering Committee on COVID-19 has put 6 states on red alert. The affected states are Lagos, Oyo, Rivers, Kaduna, Kano, Plateau, and the FCT. Chairman of the committee, Boss Mustafa, who noted that the nation has in recent time continued to witness worrisome early signs of the third wave of the pandemic, advised concerned states and the country as a whole against losing their guards. He also recommended the decentralization of the Eid prayer on the day of the festival for outdoor, suspension of Duba activities, and observation of limitations on all indoor gatherings. Till date, 169,532 cases have been confirmed, 164,699 discharges, and 2,127 deaths have been recorded in the country by the NCDC. Globally, over 191 million cases of COVID-19 have been confirmed, while more than 4 million deaths recorded.
It's still Sound Health on Lagos Television. Joining me now to look at the Delta variants in Nigeria is a public health physician, Dr. Jamiyu Ganiyu. Welcome to the program, Dr. Ganiyu. Dr. Ganiyu, welcome to the program.
Yeah, you're welcome. Thank you very much.
How worried are you about the case of Delta variant in Nigeria? Could this trigger a third wave in the country?
Well, it calls for concern, but we need to look at the fundamental in the sense that as long as that continues to be transmission of the virus from one person to the other, there is bound to be other variants that will emerge at the end of the day. Because the core thing is how we are going to reduce transmission, not only in Nigeria but globally. Because the issue of variants, initially we started with Alpha strain, which emanated from UK. Later on, we had that of Beta from South Africa. Now we are now witnessing Delta. Even the Delta, we now have Delta Plus. So as long as there is continued transmission, there is bound to be a new variant. We'll be worried in the sense that even before the Delta, any new variant has been associated with increase in transmissibility, increase in severity, and rate of hospitalization. So that's it's a global thing. It's not only limited to Nigeria. So it really calls for concern because at the moment is causing a lot of issues in a country like, it started anyway from India, and probably in part of Europe now, we are now witnessing a kind of third or even fourth wave in some countries. So it really calls for concern in Nigeria, and we need to be prepared for it.
What are the symptoms of these Delta variants? Is it different from what we know before now?
Well, you see, one thing about Delta variant actually emanated from India. What makes it a bit different from Alpha and Beta is because it has a double mutation. We'll be having those ones that had one mutation. Mutation may change. You know, the virus has some spikes. So the previous one has been a change, a kind of one of the protein that is the spike. Now we are now having kind of double kind of mutation. That one makes it a bit different from the previous one we've recorded. But most important thing is not about the Delta variant. It's how are we going to prevent transmission from one person to the other. And that has to do with the fact that we need to look at our immunization. Best bet is vaccination, on which unfortunately we'll be able only to vaccinate only about 1%, mainly of the frontline worker, that is health workers. What happened to the other people? So that's one. Then two, the second approach is how do we ensure people comply with the non-pharmaceutical measure, realizing that people are already fatigued, people have gone back to their normal ways.
Does the current COVID-19 test indicate if I have had a particular variant, and do they identify which name of the variant is?
For now, the normal testing can only just confirm whether somebody is infected or not, especially if we are suspecting somebody based on the existing case definition. The current testing can only confirm whether you are positive or not. But in between, there is a routine kind of testing which is called genomic sequencing, which is being carried out, which is randomly done. Not if they do that for everybody. They know the people in the NCDC know they randomly select sample and try to look at carry out such kind of genomic sequence to know actually what is happening, but it's not routinely done for everybody to know whether somebody is having Delta variant or any other kind of variant.
Despite vaccination is ongoing, how does the Delta variant dodge the immune system?
The current increase in number of cases in Nigeria, we cannot categorically say due to the Delta variant. But one thing I know is that as long as we do not comply, people have resorted to their old ways of not complying with the non-pharmaceutical measure. There is bound to be increase in transmission from one person to the other. And you can believe with me now, on a daily basis, you see people attending one burial, one wedding, and so on. So it's bound to happen as long as people fail to comply with the non-pharmaceutical measures. And coupled with the fact that a lot of people are not being vaccinated, only barely 1%, which is another factor that is responsible for that.
The Health Organization says most people that are infected with the Delta variant have been fully vaccinated. Does this Delta variant dodge the immune system despite vaccination?
I won't want to say, I want us to let's look at the vaccines, the current vaccines that are in circulation at the moment. I want to tell you that we find that none of them have 100% efficacy. Mm-hmm. And it has also been found that even with this Delta variant and every other variant that we had before now, it has been found that they reduce protection to a certain level. That is the level of protection they have. And it has been, based on literature and based on expert review, it has been found that some have some protection against a certain variant when some do not have at all. So, another thing I want to say is that most of the vaccines we are currently are in the third phase. A lot of things are yet to be known about some of these vaccines. It's still a kind of development in progress. We've not actually, we cannot at this moment say, okay, this is a complete package that regards to this vaccine. We are still learning from some of these vaccines. So I want to believe, but what I know is that based on recent reviews, it has been found that those AstraZeneca vaccine and the Pfizer vaccine have a kind of 96% efficacy against the Delta variant, but I'm not too sure of every other one at the moment. Yes.
The two most proven tools are key. They are the public health measures as well as vaccination. Despite this, people are still disregarding the protocols. The Lagos state government has also reintroduced all these COVID-19 health protocols now. What other approach would you recommend to achieve protection now, despite the fact that some members of the public have not been vaccinated?
Well, scientifically and based on expert recommendation, I think the two are very, very key. But what we do, the only concern is the approach to ensuring that we get those things, get those measures put in place. For now, as I've just said, 1% coverage out of 100%. So we need to, quickly see how we can get more vaccine so that more people can, get vaccinated. That is on one point. Then, as regard to non-pharmaceutical measures, I think we need to continue in terms of engaging the community, the opinion leaders, try to, we have all the protocols on ground. What we don't need is enforcement. So I think we need to go back, sit down, and see what are the best measures. But I still think community engagement is key, and trying to kind of balance the economy with the public health protocol, I think is the way forward. And again, our leaders must lead by example. You cannot tell somebody to wear face mask, to maintain social distancing, to wash their hands, and at the end of the day, you'll be in a venue or in a ceremony whereby, sorry, you two are not doing the same thing. So how do you expect your follower to follow? They will not take you serious. And I think that aspect of compliance actually plays a very critical role, which I will advise we must lead by example so that all the followers can follow. That's one aspect I would like to actually emphasize, which I think I don't want to mention, many of our leaders are not really compliant. I don't want to tell any other person they're not compliant. At our own limit, we will still continue to engage through this communication, community sensitization, and on one-on-one, as much as we can have encounter with people, let them know the importance of the non-pharmaceutical measure, and to let them know that the virus has not left us, so it's still in the within us, and we must ensure that we protect ourselves from getting infected, especially from the severe form of the virus.
All right, thank you so much, Dr. Ganiyu, for your time on the show. We really appreciate you. Thank you for always obliging us.
Thank you very much.
All right, I have been speaking with Dr. Jamiyu Ganiyu on how to prevent the Delta variant, further spread of the Delta variant in the country. Sound Health continues with Trending Health Report. Please stay tuned. It's still Sound Health on Lagos Television. More to come in a moment. This is where we say thank you on today's episode of Sound Health. Whatever you do, protect yourself and loved ones by observing all COVID-19 protocols during the Salah celebrations and even after vaccination. Thank you so much for watching. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.